Hi, I'm Dr. Jess Goodman, a physician and president of Vital Signs. In the last couple of videos, we talked about aortic pulse wave velocity and aortic stiffness. In this video, I want to talk about human physiology and how it's very dynamic, changing on a second-to-second, minute-to-minute, and hour-to-hour basis. Our bodies are wonderful things, staying in balance no matter what we do. When you stand up, your blood pressure drops suddenly. The body then kicks into action, speeding up your heart rate, increasing the force of cardiac contractions, and getting that blood pressure to recover back to your baseline. These changes are part of homeostasis, which is another way of saying the way the body stays in balance. Homeostasis is regulated by your unconscious nervous system, the autonomic nervous system. iHeart is a way to follow these very dynamic changes and get more insight into your health. iHeart measures aortic pulse wave velocity that is sensitive to two main things. The first thing is aortic stiffness, speed with which a pulse wave travels down and back up the aorta. Aortic pulse wave velocity is the way we measure aortic stiffness using iHeart. Aortic pulse wave velocity is also sensitive to blood pressure, so that anything that affects blood pressure will affect your iHeart reading, because same reason, blood pressure will affect pulse wave velocity. So how do we look at iHeart readings in order to make sure that they are most representative of aortic stiffness and not changes in blood pressure? Well, to control for blood pressure, you do what I guess you do at the doctor's office if your doctor is measuring blood pressure. First of all, you don't go in after just having had a coffee or a cigarette or a meal. You try to relax, and your doctor may ask you to sit or lay down for a few minutes before testing. With iHeart, we ask people to sit in a relaxed way for about 2 minutes before they do a reading, so that when you do use your iHeart device, you will get a reading that is really very characteristic and representative of your aortic stiffness and isn't really being affected too much by your blood pressure. However, if you've had a stressful day, your iHeart readings will reflect this because your blood pressure may be up. When you're more relaxed, you may see your iHeart readings fall. iHeart is not a device like a weight scale that has a very stable reading. iHeart is a device that really only reflects what's going on inside. And what's going on inside is quite dynamic. So you can get insight into blood pressure changes, into the way you're feeling, the way your body's acting, and if you control for blood pressure, your iHeart readings are going to be very reliable and very consistent. Good luck and good health.